Hi, my name is Kristen. I'm one of the nurses here at Mount Sinai West on the postpartum care unit, and we're going to go over postpartum instructions for the care of the mother. For the next 2 to 6 weeks, you will be experiencing some bleeding. It is very normal to have bleeding. The blood should look, smell, and act like a period. If it gets an odd odor or an odd appearance, you want to call your doctor or midwife and make them aware of that. Occasional small clots are acceptable. If you start to pass multiple small clots over and over and over again, you want to call your doctor or midwife and make them aware. If you have one larger clot, like an egg or a golf ball size, you immediately call the doctor. You do not wait for multiple of those. Your bleeding should be decreasing over the course of the 2 to 6 weeks. If it's not, if you start to see increases, you make the doctor or midwife aware. If at any point during the postpartum period, you soak a peri-pad with blood in an hour or less, meaning fully front to back it is drenched in blood, you go to the nearest emergency room. That is considered an emergency. Otherwise, your bleeding should look, smell, act like a period, and last 2 to 6 weeks. If you develop severe or painful headaches that are unrelenting, not going away when you take Tylenol, any changes in your vision, like blurry vision or spots or floaters in your vision, severe or unrelenting heartburn, dizziness, or an upper right quadrant pain over on your side, you want to call your doctors or midwife and let them know about it. Swelling can be normal following delivery. If your swelling is increasing, however, after the first 48 hours at home, if it's increasing, you want to let the doctor or midwife aware, specifically if it's developing in your hands or face and causing you any discomfort. Pain is normal in the postpartum period. Having a baby can cause different discomforts depending on how you delivered. However, pain medication is there to assist you and should help you. If you're taking your pain medication, about an hour after you take the prescribed medication, whatever that may be per your doctor, you want to self-evaluate your pain like we were doing here in the hospital and say to yourself, am I feeling better? Is this helping me? If you're taking pain medication and you're not feeling any relief whatsoever from it, you need to call the doctors and make them aware. Pain that goes unrelieved by pain medication is usually indicative of something else occurring, and we need to know about that to check you. Pain should not be more intense or more frequent at home. It should be decreasing day by day, and you should be getting back to normal and more comfortable day by day. If you're not, if pain is getting more intense or more frequent at home and you're needing more pain medication as time is going on, again, speak to your doctors or midwife. That is very important. You need to rest after having a baby. The number one rule of having a baby is to sleep when the baby sleeps. That is very, very important. Babies wake up quite frequently for feedings early on, and so mom needs to get naps during the day and be lying down. So make sure to schedule in some naps, baby naps, mommy naps. That's very important. You shouldn't lift anything heavier than 10 pounds after delivery. For the first 6 weeks following delivery, pelvic rest is mandated by the doctors. That means no tampons, no douching, no pool swimming, no ocean swimming, no tub bathing, and no sexual intercourse for 6 weeks. If you've had a C-section, it is very important that you don't lift anything over 10 pounds and really stay home for the first couple of weeks. Relax, don't do too much. There shouldn't be any pushing or pulling of anything heavy if you've had a C-section, meaning no pushing and pulling of heavy vacuums or strollers or shopping carts. If you need to cough, laugh, or sneeze following a C-section, you can take a pillow, hold it vertically, hug it, and lean into it, and that can help to stabilize your abdomen. You can discuss abdominal binders with your doctor and see if that's an option for you for comfort also. If you have to go up and down stairs after a C-section, it is best to take one step at a time and move very slowly. You don't want to be going up and down multiple times a day, so try and organize yourself at home so that if you have stairs, you can really stay in one location longer. It is very important to follow up with the doctor 2 weeks after delivery if you've had a C-section for an incision check. Everybody needs to follow up with the doctor 6 weeks after delivery for a full postpartum check. And at that point, the doctors will let you know if you're to remain on pelvic rest or not following that checkup. It's very important to do Kegel exercises after delivery, regardless of how you've delivered. They help to make the pelvic floor muscles strong again following pregnancy. It's very important to change your pad every 2 hours after delivery. You should not be bleeding enough that it requires the change, but you do it to decrease moisture in the area because moisture can lead to different infections, and we want to try and prevent that. We'll show you how to clean yourself well with the peri bottle following delivery. We want you to be able to urinate, clean yourself off with the peri bottle, pat dry, and change your pads and do some Kegels, and that should happen every 2 hours. If you feel like you are soaking pads every 2 hours, and again, the bleeding is increasing, you do let the doctors know and make them aware of that. You also want to try and empty your bladder every 2 hours. Everything gets very weakened from delivery and the different methods we might use in labor and delivery, such as catheters or epidurals or the anesthesia for a C-section. All of those things can make the bladder very weak, and again, the pelvic floor muscles are weak following pregnancy. So you may not feel your bladder till it's extremely full. So we encourage you to try and empty it every 2 hours to really ensure that everything's starting to wake up and the bladder is getting some exercise by filling and emptying on a regular basis. If you're leaking on the way to the bathroom going every 2 hours, you want to try and go every hour. If you're still having that problem, you try and go every 30 minutes and you notify your nurse if you're here, your doctor or midwife if you're home. If you have any burning, pain, or discomfort upon urination, you want to make the doctors or midwives or nurses aware immediately. Voiding and urinating should feel relatively normal following delivery. As far as bowel movements, they can be very irregular at first. Your intestines tend to slow down following delivery because they have all this extra space now. And the different medications we use in labor and delivery, again, can slow down peristalsis. You should have at least one bowel movement every 3 days or so. If you're not having that and you're home at this point, you want to make the doctors aware and see what they would like for you to do. If you at any point have diarrhea, please stop using any stool softeners or laxatives. And if you have diarrhea and it lasts 3 days or more, again, you should let the doctors know immediately. That's very important. Following delivery, it's very important to wear a supportive bra. If you're breastfeeding, it's important to have support to your breasts as they fill with milk. If you're not breastfeeding, it's very important to wear a very tight sports bra and put ice to your breast to prevent them from developing any milk. We encourage you to continue your prenatal vitamin for at least the next 6 weeks. And then again, if you're breastfeeding, continue with a prenatal vitamin or a multivitamin for as long as you're breastfeeding. It's important to drink a lot of water to ensure that you can hydrate yourself following delivery. And again, if you're breastfeeding, to increase the milk production. As far as diet is concerned, a healthy diet for healing purposes is very good. If you are breastfeeding, you should be increasing your calories about 200 to 300 calories at this stage to be able to have enough calories in your system to make the milk to supply for the baby. That's in addition to a regular pregnancy diet. If you choose not to breastfeed, you can return to a regular healthy diet with a normal amount of calories for you pre-pregnancy. If you're not breastfeeding, all the restrictions of pregnancy foods are no longer needed. If you are breastfeeding, they do still hold true. However, you can be a little bit more lenient on them, like 1 to 2 cups of coffee is acceptable, and everything in moderation is okay. If you've had a vaginal delivery, again, no tub bath or any swimming. However, you can use a sitz bath, which your nurse will give to you. A sitz bath just fills with warm water. You test it with your fingers to make sure that it's warm and not burning hot. You don't want to hurt yourself. And it fits right into the top of the toilet. And you can sit in it for 10 minutes every morning and 10 minutes every night. You can also add some Epsom salts to it if you choose. It's a comfort measure. If it helps you and it feels good, continue to do it. If you're doing it and it's not really helping you too much, it's not mandatory to do. If you've had an incision for a C-section, it is important to shower every single day. You do not want to get soap directly on the incision, but if soap runs over while you're showering from the rest of your body, that's okay. But it's important to let the water hit it so it gets very clean. When you get out of the shower, you want to pat on the incision to make sure it gets extremely dry. You don't want to leave any moisture behind, but you also don't want to rub the area. You want to just gently pat it to get it dry. If you feel like you're building up a lot of perspiration in the area, you can take a clean peri-pad and wear it against the incision. It will absorb the moisture away from your skin and prevent any underwear or pants on the band from hitting the incision too closely. Do try and wear underwear or pants that go above the incision so that they won't be very tight directly onto where the incision is present. When you leave the hospital and you have a C-section, you will have small pieces of steri strips present on the incision. They come off when they're good and ready. You don't need to pick at them or worry about them. If there's any left behind, the doctor will take them off at the 2-week visit. You need to inspect the incision every single day. If there's any bleeding present, oozing or drainage of any moisture of any kind, any rashes around on the skin, if the skin around it's becoming hard or reddened, or if it's much warmer to the touch than the rest of your body, you need to notify your doctor or midwife immediately. It should not look any worse than it did here in the hospital, and do try to look at it before you leave the hospital. Be sure to discuss before leaving the hospital a family planning option with your doctor or midwife. It's important to know what your plan is for after the 6 weeks are up. You would need to call your doctor or midwife if you get a fever of 100.4 Fahrenheit or higher at any point over the next 6 weeks. If you would choose to breastfeed when your milk is coming in, there will be a possibility of a slight body temperature change, but it should not go as high as 100.4. So if you do hit 100.4, you notify your doctor or midwife immediately. Remember that after delivery, you're having a hormonal change. Hormonal changes come with different signs and symptoms, including night sweats, hot and cold flashes, and mood swings. It's very acceptable to have a little bit of the baby blues after delivery, to feel like you're crying for no reason and you can't explain why, or to feel a little bit extra anxious or snappy with family and friends around you. It's acceptable as long as it's not at all overwhelming. If it starts to become overwhelming because the mood fluctuations are so constant, you want to speak to your doctor or midwife. If it becomes constant sadness every day and you're not feeling any better at any moment, you want to let your doctor or midwife know. If you're not feeling any better by the 2 to 3 week mark, again, let your doctor or midwife know. By that point, you should be feeling like you're gaining some control over it. Also, speak to a partner or caregiver at home to make sure that they are aware of what they should look out for, so that if you're not up to discussing it with your doctor or midwife, they can do so for you. All of the things that we've just referenced are in your You and Your Baby guide, and you can also speak to your nurse about them if you have any questions. Thank you.